Joining us now is also someone who knows a lot about the Ebola crisis, the author of the new book, Patients with Passports, Medical Tourism, Law and Ethics, Harvard Law professor Glenn Cohen. Glenn, we welcome you back to America's Forum. It's great to talk to you. Happy holidays, sir.
Thank you for having me.
All right,
Great to be back.
Let's start off with conversations you and your colleagues have had about the Ebola virus and how it has traveled with infected patients and healthcare workers to the United States. The only way Ebola has come to is that the only way Ebola has made it to U.S. soil?
As far as we know, air travel has been the primary vector why people have traveled, and it's mostly been either people returning with the disease or, in one case, a man leaving Sierra Leone, I think it was Sierra Leone, with the disease.
And Glenn, in a new article, you basically say Ebola is only the tip of the iceberg. Can you explain what you mean by that?
Yeah, so we had a lot of media coverage of Ebola, which is understandable. It's scary, the disease progresses fast, and of course in Africa it's been a real crisis. In the U.S., though, it was largely a dog that didn't bark. We were very lucky. But in fact, diseases travel all the time with patients. As people travel around the world, both for pleasure and for medical treatment, they bring back all sorts of diseases with them, antibiotic-resistant drugs and the like. And really, this is, I think, a real story and one that we have to worry about in the way in which diseases travel and diseases we're not prepared for. These cost the system huge amounts of money. They infect large numbers of people, and we don't have a great way of monitoring or dealing with them. So Ebola is the dramatic one, but I think many of these smaller diseases are actually what's costing the system money and causing lives to be lost.
And tell us a little bit more about that, Glenn, because, of course, this time of year, more folks are traveling, and a lot of folks are concerned about this. There are other things, obviously, to be concerned about here. But what is the biggest risk, I guess, now? What's on your radar in terms of what might be traveling in terms of diseases on these planes?
So I think the real concern here is there's all sorts of what we call in public health commensals, which are basically bugs that in their indigenous population and people who are having them, they're really well managed. People have developed immunity in India, for example, or the Indian doctors know how to spot and identify and treat them. But when they come with a patient traveling, and I'm just picking India, for example, because that's one where we've had NDM1, particularly virulent multi-drug resistant bacteria come, when they come with a patient, all of a sudden, for that American patient, it may be a very serious pathogen, and it may be resistant to many of our antibiotics, and we may not spot it as an American patient or as an American physician just because we're not familiar with them. I mean, this was the story with SARS. This was the story of that man in 2007 who traveled with drug-resistant tuberculosis and circumvented U.S. borders, and many of them are quite serious, especially the ones that are antibiotic resistant.
And Glenn, you say high-income countries especially are at risk. What do you mean by that?
Well, high-income countries are at risk in the following sense. First of all, I don't want to say that we're perfect either. In the U.S., about 1.7 million people a year get hospital-acquired infections when they travel to a U.S. hospital. But our patients tend to travel more than the average person with high income. You have disposable income to spend, and we also tend to go to very exotic places. I mean, this is great. The world's become globalized, more interested in other cultures. But one of the big risks is if we travel abroad, we come back with a bug that might infect other patients.
Well, kind of dovetailing on that a little bit, Glenn, is what has surprised me a little bit after this Ebola outbreak, or I should say as this Ebola outbreak continues, is that more and more, it seems, American health officials want to go to these places where these diseases are originating. Have you been somewhat surprised in your research and as you talk to healthcare doctors and nurses about the amount of them who are willing to travel to these places where it's so risky?
I mean, I admire these people greatly, and I'm surprised by their own risk tolerance and their commitment to the profession that they're willing to do this. I will say one interesting piece of the story is whether their home institution has allowed them to do this. So there was recently an article in PLOS, medical journal, talking about whether home institutions have an obligation to allow their physicians or their doctors or their nurses to go abroad, or whether they can say no. And one of the issues is a lot of time off. There are risks when the person comes back and the like. But I've been surprised in a good way by the humanity of these people and their commitment to helping people halfway across the globe.
Glenn, how can technology help protect us?
I mean, so one way it can protect us is, so it turns out most modern airplanes and more recent airplanes have what are called HEPA filters, and these filters do a good job of filtering out a good amount of the bacteria. Not all of them, they're not perfect. But older model airplanes don't have this, for example. So that's one example of a technological fix. The other is as we become better at developing screening technologies that can be deployed easily in the airport line. We saw a little bit of this with SARS. We saw a little bit with Ebola, trying to detect fever from a distance, if you will. As those technologies become better, we might do a better job of being able to screen people as they come and go. If you're relying on people to tell you whether they're sick, first of all, many of them may not know it. The second is, even if they know it, they may think it's just a cold or something like that, and they want to get home for Christmas or the like, and they may say, I'm not going to tell the authorities that I'm sick. So I think that both improved filtration technologies, improved detection technologies, and of course, better antibiotics would be great. The biggest problem with antibiotics is the more of them you use and the more of them you sell, the less effective they become, right? It's unlike the more we use them, the more likely we are to get resistance.
Yeah, so there's some real concerns there with the antibiotics, but Glenn Cohen, thanks so much for being with us, author of the book Patients with Passports. Glenn Cohen. So great to talk to you, sir, and happy holidays.
Thank you so much.
I mentioned this, those folks who travel overseas to take care of sick folks. I should mention my sister, one of those folks, just recently returned from Kenya on a mission trip to do some medical work over there. And thank you to all the brave folks from this country who go over there and do that. Not an easy thing to do, to leave your families here. Well, we got much more to come here on America's Forum. Stand by. We have another Newsmax Now update coming up. Also, we're going to talk to Jeffrey Nathan very soon about the stuff happening in New York City.